Welcome everyone to our second caregiver conversation. Today's topic is understanding the impact that IgG4 related disease may have on one's mental health. I am so incredibly excited to have you all here for a very important conversation. I am Catherine Preventure, and I am the Director of Patient Advocacy. And I would like to share that prior to my role as the Director of Patient Advocacy, mental health has been profoundly close to my heart, both in my career and on a personal level. In my career, as a clinical social worker, I worked with children and adolescents who were diagnosed with severe post-traumatic stress disorder, depression, anxiety, and faced many other mental health challenges. However, it then shifted into a personal area for me when I had to support my own loved one with his mental health struggles related to IgG4 related disease. And this became a really, a reality check for me as a caregiver and a social worker that this is a crucial topic to educate the whole community on. So here we are. And before we begin such an important conversation, I'm just going to go over a couple of announcements. I'm sure by now you have all heard of the IgG4ward Jamboree, also known as the Jam, that will be happening this year, very soon, November 9th and 10th. Please know registration is still open, and we are still accepting scholarship applications to assist with travel. We really hope to have as many people from the community there with us to connect, learn from one another, educate one another. So please, we look forward to seeing you all there. 2025 is going to be a great year. We are looking ahead to some wonderful things happening, so please stay tuned. So as we begin, I felt it was very important for me to discuss the difference between mental health and struggles and mental illness. When I speak of mental health struggles, what I mean is not necessarily, a mental illness diagnosis. It's something that you were diagnosed with from a doctor, which that could be your experience. And if it is, please make sure that you acknowledge and take care of that part of you. But what I'm referring to here as a mental health struggle is when the broader impact on our mental well-being. So when you find yourself feeling less joy in the things that used to bring you a lot of joy, day-to-day activities seem really hard to complete. You might find yourself overwhelmed with things that used to be extremely easy. So recognizing these signs, feeling less like yourself, loss of joy in activities are all very important. And please know that you should acknowledge those feelings and you are not alone in those feelings. And that is part of the reason why we're having this conversation as well. Now, a mental illness that is diagnosed, such as some of the things I listed before, anxiety, depression, post-traumatic stress disorder, those all generally need to be treated by a professional. And mental health struggles can impact any of us at any time, any day. And those also may need some professional support. So please be aware of that. So to discuss this important topic of mental health struggles and how it relates to people living with IgG4 related disease, I have invited four amazing, inspiring individuals living with IgG4 related disease. Damon Brooks, Andrew Preventure, who's also my husband, Sabrina Riddle, and Kim Skelly. So momentarily you will see a conversation with them and they will share their journey, some coping skills, and how their mental health has been impacted. But before that, I have asked Dr. John Stone to join us today to give his insights as a physician as they relate to mental health and what he has seen and the importance that he feels mental health is in regard to his patients. So thank you so much, Dr. Stone, for joining us today. It is an honor to have you.
Thank you. Thank you for inviting me to join you today. In thinking about what I might say, I thought very quickly to two of my own medical heroes. I've had lots of medical heroes, but I chose two of them to share with you briefly today because of what they said, because of the course of their careers and the role models that they set. I have found them so inspiring. The first is Sir William Osler. He was the first physician in chief at Johns Hopkins Hospital in the 1880s, and he really revolutionized American medicine by putting it on a scientific basis. He was perhaps best known, though, for his teaching at the bedside. And here he is at Johns Hopkins Hospital at a patient's bedside. And he wrote books of aphorisms, and much has been written about Osler. But the one that I find most memorable is his saying, "Do the kind thing and do it first." Because you may have lots of ideas as a physician about what you would like to do for a patient, but the patient may have a very different set of concerns that are really paramount. The patient may be concerned about whether the diagnosis is right. The patient may have been told that he or she has cancer, and maybe that is foremost in the patient's mind. Maybe the patient is worried about medical bills. And so a good physician has to take these things into account and do the kind thing and do it first. The second physician that I want to share with you was a contemporary of Osler's. We could move to the next slide.
Sorry about that. There you go.
The second slide was a contemporary of Osler's and less well known, I think, probably, but still a great man in his accomplishments in his day and how he is remembered. This was Edward Trudeau. And you can see how thin Dr. Trudeau was. That is because he had tuberculosis. He himself suffered from what in those days was a chronic disease. And his attitude about medicine and this statement, to cure sometimes, to relieve suffering often, to comfort always. This statement, which I think is one of the greatest things that any physician has ever said about medicine, must have been driven by his own experience having tuberculosis himself and taking care of patients with tuberculosis himself. He founded a sanatorium for tuberculosis in upstate New York, and it is still a scientific institute to this day. And it really addresses directly where we are with IgG4-related disease, I think. To cure sometimes, I would like to think we're going to get to a cure almost all the time in my career. To relieve suffering often, but to comfort always. And the statements of both of these physicians really, I think, underscore the paramount nature of putting mental health aspects first when taking care of a patient with IgG4-related disease. So thank you very much for asking me to join you today, and I'm looking forward to the show.
Thank you so much, Dr. Stone. And I found this picture online that I wanted to put on as the slide when I was thanking you because, you know, this I feel is part of your practice, making sure that you reach the heart and soul of your patients as well. And, you do lead by those mottos that you follow. So thank you so much. And I hope to have more conversations with you in the future, maybe more webinars in regard to the importance of mental health and how physicians can maybe bring it in a little bit more into their practice. So thank you so much again for joining.
Thank you.
We will now move on to the conversation with those four remarkable individuals that I spoke of just a couple minutes ago. This is a pre-recorded video, as you know, this topic is a vulnerable topic, and we felt that in an effort to make everybody feel their best and feel comfortable speaking on this topic, that we would pre-record it. So please enjoy. And again, thank you all for joining us today. I would like to begin by introducing all of you. We can start with Kim, and you can just share a little bit about your IgG4.
Oregon with my wife, our 2 dogs, and 2 cats. And my IgG4 journey was relatively short, however, not without some roller coasters. I was at work. I work as a flight nurse full time, and I was at work on shift when I developed an acute onset of abdominal pain. Progressed into nausea, vomiting, took myself home, tried a bunch of home remedies to see if I could get my pain and discomfort to subside. And I eventually hit a point where I was like, something's not right. My wife took me to the local hospital, and a CT scan confirmed that I had a bowel obstruction that was caused by a 5 by 7 centimeter mass. At that point, the in-house surgeons and oncologists were consulted, as well as an outside teaching hospital in Portland, because they were very concerned for ovarian cancer. I was admitted at the local hospital because they didn't have any bed availability to get me to Portland, with the plan to do a CT guided biopsy of the mass. The day that they took me down to do the procedure, they did an initial CT scan and saw that I actually had a perforated bowel. So I was taken to the OR emergently. The mass was removed from my abdomen, as well as 12 centimeters of dead bowel. They closed the 2 bowel loops back together, and I spent 2.5 days in the ICU as a result of all of this, a week total in the hospital. After that, it was about a total of 6 weeks before I was actually diagnosed with IgG4 disease. I saw the specialists in Portland. They said, yep, your CT scan looks like metastatic ovarian cancer. We want to do a second biopsy to confirm this, because your first came back non-malignant, like not really abnormal, just some scar tissue. So they did a second ultrasound guided biopsy, which also came back negative. And thankfully, the pathologist at the teaching hospital reviewed the initial results from the mass, as well as his own results from the second biopsy, and he was the one who confirmed the diagnosis. So it was quite the journey.
It sure sounds like it. And you know, you will hear from everybody else too as they continue with their introductions. That C word, that cancer word, just is usually the first very scary thing that you all hear. Thank you so much, Kim. Sabrina, you participated in our first ever caregiver conversation back in March and shared such beautiful insights into mental health. You have been living with this disease for a long time and have a wealth of wisdom to offer. Could you share your journey with us?
Absolutely. Thank you, Catherine, for the invitation to return and speak on mental health, or the impact of mental health on my mental health with this disease. So I've been living with the disease since 2011, and my IgG4 journey began very innocently with kind of a fullness in the year. Like I said, it started in 2011, but I wasn't officially diagnosed until 2013. That's almost 3 years of living with the unknown. My IgG4-RD primarily presents in my brain in the form of pachymeningitis. That affects my meninges and my cranial nerves and my orbits. Understanding that, when I have a flare, I suffer with these terrible, almost intractable type headaches where I can't get any relief. When I do find some relief, it's only through using a combination of very strong medications that completely wipe me out. Like most of you on this journey, it's been both physically and mentally challenging, I have to admit. Experiencing the trauma of an unknown diagnosis to being misdiagnosed, and then having had, ineffective treatments and unnecessary surgeries has been really mentally taxing. So when I finally received a therapeutic intervention that led to relief and remission, gosh, there was no greater feeling. And I felt like, all right, we got it done. But then there was the mental aspect of it, So I've tried to remain hopeful through it all with faith, family, and therapy. trying to stay focused on, not just staying alive, but thriving while living with IgG4-RD.
Thank you so much, Sabrina. Andrew, I do know your story as I have lived it right along with you. Like I said in the beginning, Andrew is also my husband. I have been his caregiver for the past 4 years. I would like him to please introduce himself and let you know about his journey.
My name's Andy Preventure. In June of 2020, I had a mountain bike accident where I went over the bars, broke half my ribs, broke my collarbone in a couple places, punctured, collapsed lungs, emergency room visit, ambulance ride to the emergency room visit. And while putting in a chest tube, they did a CT scan and noticed that there was a lot of nodules in my lungs. And the doctor in the emergency room informed me that this looks like an aggressive form of cancer. You got to get right on it and you're in some trouble. So got out of the hospital all healed up and started seeing doctor after doctor, pulmonologist, hematologist, all the ologists. And after some biopsies, I had a tracheotomy done that pulled some lymph nodes that showed negative for all the bad stuff, all the cancer type stuff. And shortly after that, I had a biopsy done of a piece of lung that also showed negative for carcinoma. And the pathology went across the desk of a doctor who knew exactly what it was. And since then, I've gotten into treatment with him.
Thank you, Andy. Damon, you're up next. Could you wrap up our introductions by sharing a little bit about your journey?
Sure, and thank you for having me. So, my name is Damon Brooks, and my IgG4-RD journey started back in March of 2022. Shortly after I got back from a trip to Hawaii, I had started working out, just trying to shed some weight and be healthy, live right. And one evening, on a Wednesday evening, specifically, I took my socks off, getting undressed for bed, and noticed that the indentation in my left leg was deeper from the elastic of my sock. And I was like, oh, that's odd. So Thursday, I looked at it again. I noticed it was a little deeper, and then my toes were swollen. It's like, oh, that's unusual. I've never experienced swelling in my limbs before. So I went online and scheduled an appointment with a primary care physician. Just so had it, she had an appointment for that next Friday morning. And someone told me to take the appointment, which I did. And I went in and she's like, oh, see, I'm swelling. I'm going to run some tests and call you back. And it's just kind of watch your salt intake. And I was like, sure. And so went through the weekend. And then that Tuesday, I got a phone call from her office telling me I need to go to the emergency room immediately. And I was like, oh, okay. So got myself together, went to the emergency room. They ran the same test, and the internist came in, was scratching his head at the same time, and his nurse just kept poking on me and like, are you in any pain? I'm like, no. It's like, Mr. Brooks, I'm just going to give it to you straight. Like, your liver and kidney functions are very, very high and abnormal, and we don't know what this is. I'll let you go home, but I'm going to put a team of specialists together for you, as long as you promise to follow up with them. I'm like, sure. I'm going to get to go home. Yeah. He said, before I do that, I want to give you a CT scan of your abdomen, in your abdomen area. And I'm like, okay, yeah. So I'm laughing at my best friend this time. And he came back and his facial expression just had completely changed. And I looked at him like, okay, what's going on? He said, you're not going home. We believe you have metastatic cancer because we found tumors throughout your stomach, a tumor in your liver. Your pancreas is inflamed. We found 2 tumors on your kidney and 1 on your right kidney. And he just started naming all of these different cancers, and I'm still trying to digest metastatic cancer. My day started out just, and so he's like, I said, okay. He's like, the last thing he said, you have hope, and I told him I have faith in God. I'm very religious, and I said, I'm going to get through this. Just go ahead and do what you need to do. So the next day, he took me in for surgery immediately. He said, I'm going to do least invasive procedures first, and so they did biopsies on the tumors in my stomach. Waited 2 weeks. I was nervous, and I'm just holding on to my faith. Everything's gonna be okay. They came back benign, and then it's like, okay, we don't know what this is, Mr. Brooks. We need to figure this out. And by that time, March, April, until July, I was in the hospital for the first time for 7 days. My legs had just ballooned like the marshmallow puff man. They were so big. I was out of breath. I deteriorated very badly. I had to end up back in the hospital in July. By this time, they had did all types of tests, biopsies. They thought I had bone cancer, blood cancer. I saw all the ologists. They took my case to the tumor board. They could not figure out what it was. So that became a little stressful, but I was just still holding on to my faith that I would get through this and they would figure it out. And by July, 4th of July, I got so sick, the swelling had got so bad that I had to go back to the hospital. They kept me in. They said, Mr. Brooks, we're not going to let you out till we get the fluid off of you. And we're going to do some more biopsies. We're going to do your kidneys first and then your liver. They did a biopsy on my kidney, and then they also did an upper endoscopy and went in because I developed more tumors in my stomach. And then that came back a couple of weeks later. She's like, good news, I know what it is. And she said, it's a rare autoimmune disorder, but it's causing a lot of damage to your kidneys. And I said, well, what is it? And she said IgG4-RD. And I was relieved, but then I got a little nervous because my mother had multiple sclerosis and her sister had lupus, and they passed away from complications to both their autoimmune disorders. So got myself together. I was like, okay, what do we need to do? We're going to beat this. And they put me on steroids. Everything started to go back to normal. I did damage my kidneys because I do have membranous nephropathy, which is secondary to the IgG4-RD. But after 2 years later, I'm doing well, and it looks like it's going into remission. I also had an inflamed heart. Forgot about that. But yeah, so you're the first. I passed out. I had to have a mammogram because my breast had swollen up and it was very painful. And so it was like, well, we're gonna have you do an ultrasound. I went into the women's breast imaging and she's like, no, we're giving you a mammogram. And I was like, oh, what? And so thank God they came back benign, but it was just a lot had happened first year. So
Absolutely. Thank you all so much for sharing your experiences. I know it's not easy to rehash these stories, so thank you so much. And it's clear that the journey with IgG4 related disease can sometimes be long, and for some of you it wasn't as long, but no matter the duration, it's extremely complicated. And the road is still filled with uncertainty, with misdiagnoses, and sometimes even the fear, for all of you, of a terminal illness. And these experiences, as you all know, and I think you all kind of touched upon it a bit, they weigh heavily on our mental health. You're thinking about it every day. So with that in mind, I'd like to ask, do you feel that the long road to diagnosis and the many misdiagnoses, sometimes including terminal illness, had an impact on your mental health? And if so, in what ways? And Sabrina, I'd like to start with you, please.
Wow. Catherine, I've had a lot of dark days, in my life and my years of living. But having to stare down my own mortality in the face of this unknown disease was probably the most frightening thing I've ever had to deal with. In the beginning, there were so many more lows than there were highs. But I need to point out that's not the case anymore. There are more highs than lows. But there was a period in my life, about 3 years, that was marked by a revolving door of surgeries. Just as quickly as the masses were removed, they would return, and they would return seemingly with a vengeance. I think kind of during that period of time, I can honestly say I felt a lot of despair, and there was a lot of lamenting. And if I'm being honest, back then I didn't know if the lament and the lamenting and the despair was brought on by the mental anguish of the disease and not knowing what it was, or if it was brought on by the physical exhaustion, of going through, hey, we discovered a new tumor, you got to go to surgery, now you got to recover from surgery, and that cycle that continued. It wasn't until I sought, some counseling that I realized it came from both. It came from the mental anguish and the physical exhaustion. And so it absolutely has had an impact on my mental well-being.
Thank you so much for sharing that, Sabrina. Andrew, can you go ahead and share with how it's impacted your mental health?
Yes, it created a lot of fear and anxiety for the future. I feel like I was always waiting for the other shoe to drop, always just spiraling and spinning and just not able to catch my breath, and at the time I didn't really, I was always aware of mental health. I was always a big advocate of mental health, but never for myself. You know, like I was always concerned about other people and watching other people, but never took the time or found the tools to look within and say, hey, I might be going through something. So slowly, piece by piece, I came to realize that, this is weighing heavy on me and it's time to do something about it.
Thank you, Andrew. Damon, how about you? Has your diagnosis had an impact on your mental health?
It has. I found it had me really test my faith. Like, okay, let's see, like, you say you claim you believe, let's see how much of a believer you are. And it was such an emotional roller coaster from the moment from the emergency room and then finding out that you don't have cancer, but what is this? So I found that, and I have a good support group, but a lot of times, they can't be with you like in the midnight hours at 2:00 in the morning. So I found a lot, I had encouraging myself and talking to myself, letting it's going to be okay. But I also had enough self-awareness when I get to those moments where I couldn't encourage myself, I would reach out and I would pray. And then I would also call like a prayer partner. I'll call on the best buddy, like, okay, this is really having an effect on me, so they can help get me out of that dark place. And I think having self-awareness and, it's okay to call on other people. To Andy's point, I'm used to caring for other people. I wasn't used to caring for myself. And so I had to be honest and transparent when I get in those dark moments, like, okay, it's okay to reach out to other people to help you get through this.
Thank you, Damon.
Sabrina, Andrew, and Damon all said things that I resonated with immediately. Although my road to diagnosis was not that long, from the time I was initially admitted to the hospital April 14th, 2023, and received a diagnosis May 26th of 2023, so relatively quickly. However, just the roller coaster of, as Sabrina described it, staring down the face of your own mortality and not knowing, am I going to live 6 months? Am I going to live 3 months? Was really, really tough. I definitely struggled very hard with the spiraling that Andrew described and the fear that Damon spoke of as well. The biggest thing that I also struggled with was just feeling so defeated. Nobody could tell me definitively that, yes, this is cancer, but also nobody could definitively tell me, no, it's not. So that was definitely weighed heavy on my mental health as someone newly diagnosed.
Mental health challenges often surface at different stages, like you all said. Sometimes they arise early while navigating your multiple diagnoses, like you both just, Sabrina and Kim said, staring down your own mortality, or they become more apparent later as the reality of living with a chronic illness sets in. And I think some of you touched upon that as well. And these struggles are recognized internally, while others might be able to, like Damon said, find support from friends, family, but other people might have to wait until a healthcare professional points out that maybe there's some struggles going on within that aren't just the physical struggles, but more some mental health struggles. So with that in mind, I'd like to ask you all, was it you or someone else who first recognized that maybe you were struggling with your mental health? And Damon, we can start off with you.
To answer your question, it was me. I would say it was me. Like I said earlier, when I found that I was going into a dark place, I would, talk to myself, pray, and then I would call on somebody. But I think what was scary, I did as much as I could, everything that was going on with me until somebody saw me and they physically saw like, oh, hey, you're sick. But after diagnosis, after I started getting better, I think what really hit me was reliving what my mother had gone through with her multiple sclerosis. And it was like a 8-year journey from her time, when she came out of her relapse. She had a relapse until she passed away. And so I had to battle in my head, like, that's not going to be my story. And just pull on her strength to help get me through. And I think that's what I struggled with the most, was just trying to encourage myself, saying that will not be your story. You will not succumb the way your mother succumbed to MS, which is autoimmune disorder.
Thank you so much, Damon. Kim, would you like to go next?
Yeah, so similarly to Damon, I kind of knew that I wasn't doing well. I've actually had previous mental health struggles. I'm a huge proponent for counseling. I've been going to counseling for years. So I knew enough that I wasn't doing well, and I noticed it, but it was my wife who really noticed like the extent of how kind of deep I had spiraled, how much I was really struggling. So I was fortunate to have somebody in my corner who knows me so well and could really kind of check in with me and be like, hey, I know you're not doing well, but I'm seeing that you're really not doing well. Like, let's talk about this.
Excellent, thank you. Sabrina?
I love that Damon said self-awareness, because that's so true. It just really hit home. You know, I recognized, like the others, that I needed intervention to manage kind of the mental load of everything that was going on or that had happened. I had years worth of stuff to unpack, Catherine. You know, remember, I've been dealing with this for 13 years. And I didn't have any of the resources that we have available today. There was nothing, no foundation, no community on Facebook, nothing. And so, you know, I I said, you know, Sabrina, it's not just the past experiences that you have to deal with regarding this disease, but you need some tools to help manage what's going to happen in the future. How do you navigate future, you know, flares and stuff like that? So I sought out counseling, not at the behest of anyone else, but because I could not move forward without addressing that aspect of my wellness. I just couldn't.
Thank you so much. And I want to touch upon the self-awareness as well, because, you know, my ears definitely perked up when Damon said that. And I feel self-awareness is so important. However, I think as humans, sometimes we try to keep that self-awareness at bay so that we don't have to acknowledge what we are aware of, what's really going on internally. So kudos to the both of you for, you know, listening to yourself and acknowledging that self-awareness. Great job. And Andy, we can finish with you. Was it you or somebody else that noticed?
I would have to say it was me to start. I think at the time I had noticed some changes, noticed you know, being down in the dumps a little bit more, trying, you know, it was harder to find the light, harder to find the silver lining in things. And I think at the time I said to my wife, who you know, is a clinical social worker, I made a joke just to kind of break the ice, and I remember saying maybe I should go on something. And from there, that opened up a lot of conversations between my wife and I. And once we discussed it a little bit, my wife reached out to my doctor with me involved, and we talked about it at the next appointment, and we kind of planned the path going forward.
Excellent. Thank you so much, everybody. These are all very insightful responses. And so now we're going to shift gears a little bit. And I'd like to shift to coping mechanisms and strategies. And some of you have touched upon as we've been talking about it, and that's great. I appreciate it, but let's dive into it a little bit more. So my next question is, what happened to your mental health after diagnosis? I know we touched upon that, but how did you cope? And what strategies helped you the most? And for this question, I want you to think back to your darkest times. You know, when you were most anxious about what you were being told, when you felt the most stressed, no matter where it was on your journey. But what did you do to manage those emotions? And I'd like to hear from all of you on this, but let's start with Kim, please.
The biggest thing that I did to really help cope and manage my emotions when I was going through the process of obtaining some sort of a diagnosis was just staying in the present. There was so much what if, unknowns. Dr. Google, unfortunately, is one of the worst doctors you can consult. So my wife and I made the decision not to research into anything until someone could look us in the eyes and say, we are officially diagnosing you with this, and this is the evidence that we're showing you as a result. So that was really, really pivotal because initially it was very, very easy to just spiral into, like Sabrina said, looking at your own mortality in the face. I mean, especially as I was 35 at the time. That was just, and previously healthy, that was definitely something that really kind of kept me going as well. I also touched on that I've been to counseling. I continue to go to counseling. I actually went weekly instead of monthly during this time. My wife and I went to couples counseling as well, just so that we could really learn how to kind of tackle this, not just medical trauma that I had experienced, but emotional trauma as well. And then some other things, a lot of puzzles. I'm a big puzzler. Anything that can kind of get my mind off of things. So puzzles, trashy TV, video games, anything that I just have to focus on that there's a task at hand. I really did well with that. And then two things that I still rely on currently in those really like anxious moments are something I learned from my counselor is the box breathing. So the idea is you inhale for 4 seconds, hold your breath for 4 seconds, exhale for 4 seconds, and then hold your breath for 4 seconds again. And it taps into your vagus nerve and will help kind of slow your heart rate down, slow your breathing down. And that has been something that I use, I mean, almost on a daily basis. So I was fortunate to have some good tools in the toolbox that helped me through a difficult time.
Absolutely. Thank you so much. You really highlighted so many great tools just in those couple of minutes. So thank you so much. Sabrina, can we transition to you?
I hope my response doesn't sound crazy, but so how I deal with it is so let me say it like this. When I'm in a flare, there's a significant amount of fatigue and pain and brain fog. And this is when I feel guilty and sad because I'm not on my A game, if that makes sense, you know. And I have a hard time managing the invisible labor. And what I mean by invisible labor is keeping up with things at home, you know. I'm the wife, so I'm keeping up with appointments for me and for him, when things are due and planning celebrations and remembering birthdays and all that just kind of I don't have the energy or the mind to do it when I'm in the middle of a flare. And so I feel guilty and I would get down on myself, but then I started, you know, some self-talk and not, you know, self-talk in that I'm just making up something, but I praise and I remind myself of who God says I am. And I read declarations, you know, regarding my strength and my mind, that I'm solid. And that kind of snaps me out of that momentary, oh girl, you know, you're crazy, you forgot this, you know, you're dumb. How come you didn't remember, you know, your sister's birthday? So it's that kind of thing, kind of motivational from a faith perspective, who I am. And also I'll go back and I keep, I don't necessarily call it a journal, but I keep writings of things that happened in my life, and not necessarily in a journal form, but I'll go back and I'll read those things of when I was on my A game. This is who you are, not this moment you're suffering while you're suffering.
Thank you so much. And that is not crazy at all. I love that you're able to speak to yourself like that. That is so powerful, and not everybody's able to do that. So thank you, Sabrina. Damon?
Yeah, so similar to Sabrina, this may sound crazy. So first, my faith family and friends helped me through. But what I learned, like I mentioned earlier, like I have a great support system, but they can't be with you all the time. And it seemed like everything's always the worst at nighttime. So, when I couldn't sleep and I was doing the rocking, sometime in the morning, you were just in pain, or then those thoughts would come in your head. That's when I spend a lot of time praying and meditating and just talking to God. So, and physically, I may have been in pain, but the peace I get, because I just learned a lot about myself, a lot of self-reflection. And I also learned to be thankful for some things. That may sound crazy, but although I was going through what I was going through, I started to be appreciative of the things that I did have. Like I had my family, I had my friends. Some people don't have that. I'm not homeless. I had good health insurance. I had a good medical team. So I held on to those things, knowing that I'm going to be okay. I'm going to come out of this. I'm going to come out stronger, and hopefully I can share my journey to help motivate other people. And so at the end, once I start coming out of when I would come out of those dark moments, I would come out just better. And and all the time my doctors were like, "You're so happy." Yeah, I'm here. I'm able to talk to you. I'm able to articulate what's going on with me. I'm able to pay for this. So I started just looking for little things to be appreciative, and that would bring me out in those dark moments.
Excellent. Thank you. And Andy, we'll finish up with you on this one.
I've always, especially pre-diagnosis, I was always active. I found a lot of joy in cycling, love music, concerts, found a lot of ways to keep myself busy and happy. Post-diagnosis, when a lot of mental health stuff was going on, I found a lot of strength in community. Whether it was just, some of the adults at the playgrounds, at the kids' school after just talking, and, communities also within IgG4 related disease. I got into some communities there, some good people that understand some stuff, but I was also very fortunate that I've got a wife that totally put everything that she had going on to the side and made me the focus. So I'm very, very lucky for that.
Thank you so much, Andy. And thank you all for sharing how you've navigated those difficult moments, because we all know that some of those days were very dark. And it's truly so inspiring to hear from each and every one of you what you have done, how you've gotten yourself out of those dark moments, because personally, I'm not sure I would have been as strong as each and every one of you. So, great job. But as we know, living with a chronic condition like IgG4-RD requires ongoing care, not just in the hardest times, but every day. And coping and self-care are vital for maintaining balance. These days in our society, we often hear about self-care in terms that sound luxurious. Bubble baths, spas, massages. And while those are certainly, beautiful things that I'm sure all love to engage in, self-care isn't a one-size-fits-all. And it doesn't need to be glamorous or expensive. For me, self-care looks different depending on the day. Sometimes it's riding my bike, doing yoga, or just moving my body in ways that feel good. But other times, I get lost in my music, which helps me relax and reset. But on days when I'm too busy, I can't move my body, and I don't have IgG4 related disease. So I'm certain that there are many days for you all that this happens. I have to be flexible with my self-care. So I have found different ways, whether it's watching the sunrise or the sunset, watching my boys play outside, just finding that minute for myself. So I would like to hear how you all, and you touched upon it a little bit in our past question, but what your daily coping and self-care looks like, and how you manage your mental challenges, your physical challenges.
On a daily basis, I usually manage my mental health. I meditate, I do yoga, I ride my bike, I listen to music, and wrap my hands around my kids.
Thank you so much,
They mean the
Andy.
world, and they certainly are the driving force.
Thank you. Kim?
On a daily basis, there's a couple of things that I have been trying to do to help manage my mental health. I'm not currently in remission, so like Andy was kind of saying, I'm a very physical person prior to diagnosis. After diagnosis, that's definitely become more difficult. So doing things like mountain biking, running, lifting weights, I can't do it as consistently as I wanted to before. So I've had to kind of scale back, and things that I do pretty consistently day to day are definitely move my body in some way that feels good, whether it's stretching, whether I want to lay on the floor with my legs against the wall, if I'm feeling well enough to go outside and mow the yard, pick some weeds. I mean, it doesn't have to be a 2-hour gym session is one of the important things that I've learned. And also just to get outside. when I spiral, I tend to just kind of stay inside, listen to music, hunker down on the couch. And it definitely just, even going outside, even if the weather's not great, just tends to lighten my mood a bit, and really help with how my emotions are that day. And then the last thing is baths. I'm a huge bath person. And I know that Catherine said that a lot of times self-care is looked at as these luxurious things. I'm talking basics, like we're talking Epsom salt and the bathtub that I barely fit in, but it helps not only ail physical symptoms, but also is just a really relaxing environment for me. I have a Galaxy LED I turn on, shut the lights off. It's a vibe. So
I love that. I absolutely love that. Damon, how about you? And then we'll end this question with Sabrina.
Day to day, similar to what I mentioned, just finding appreciate the small things in life. Like taking walks. My dog has a golden doodle. Spending time with him. I'm talking to my friends and family. I love to laugh. Laughing is my thing, making me laugh. Talking to my friends and family. Praying in the morning, but then just in the evening time when the sun is setting and the cloud skies is like this mixture of purple and orange and blue. Stop and just there's so much that I have to be appreciative of, and I just don't take the small things for granted, and that helps ground me. I love when the seasons change, like spring. When spring comes, lights start to come on the trees, and you see the butterflies and the birds are singing. In the fall, when the different colors, things like that, that helps me get through. I will just stop in the middle of the day, work day. If I get stressed out, I'll stop. Depending on where I'm at, if I can walk outside, I will. If not, I'm working from home. I'll make sure I just take a deep breath and squat, come back, and then that's how I get myself back together.
Excellent. Thank you so much. And Sabrina?
Catherine, I think this is probably the easiest question you've asked so far. And I'm hearing some commonalities between us all. Like Kim, I like water, but I like to take a shower. I'll take a shower 3 or 4 times a day, especially when I'm flaring and I feel stressed. I'll just go jump in the shower. When I'm cold, I'll go jump in the shower. When something's bothering me, I'll go jump in the shower. And I tend to not watch a lot of television, especially the news, because there's so much negativity. It brings me down, it gets in my soul, and I try to reject anything that brings me down. But the biggest thing for me in terms of self-care is simply getting lost in music. There's a quote by Elton John that says, music has healing power. It has the ability to take us away, take people out of themselves for a few hours. And it certainly does that for me. So that's what self-care looks like for me.
Beautiful. Thank you all so much for sharing those practices. And I am certain that when others watch this, they will either relate or they'll say, oh yeah, I could try to do that as well. So great job. Thank you. It's clear that finding what works for each of us is incredibly empowering. So I know once you all were able to be like, hey, this works, this bath feels good, I'm sure it felt really great. However, we know that with the best intentions, taking care of our mental health isn't always easy. It's getting better in our society, but there are still a lot of barriers that people have to face, whether it's stigma, access to care, high costs of treatment, or even the time and energy it takes to focus on our mental well-being, especially for people within your community who are oftentimes spending a lot of time focusing on their physical health. So the thought of even having to care for another part of yourself could sometimes feel daunting. And also gender or cultural backgrounds can also shape our willingness to seek out support or talk openly about our mental health struggles. So with our beautiful diverse group that we have here, I really want and think it's important to recognize how everyone's backgrounds and the societal expectations have influenced you talking about your mental health, accessing care. So if we could just explore some of these factors, and if you feel that you ran into some barriers when trying to just do right for yourself.
I haven't experienced any barriers, but I don't know if it's a cultural issue, but primarily in the African American community, we shy away from professional counseling. There's kind of this perception that if you seek counseling, then you lack faith. I don't believe that to be the case. I believe that, you know, you've got to take care of your total health, which includes your mental health in most cases. My faith is as strong as anyone else's, and my faith is actually what kept me from drowning in despair, and the despair that I talked about earlier. But what I also know to be true for me is that my soul, meaning my mind, will, and emotion, has to find ways to manage this diagnosis, and it's not always doing it in isolation. And so I needed to seek someone, counseling through someone who had the tools to help me manage it.
I agree with Sabrina, like my faith, I hold on strong to my faith and my faith in God, but I also am aware, I have enough self-awareness to know that we have professionals for a reason, and God gifted them that talent to help us when we are in need. So I also encourage people, yes, it's good you have your faith and that you're praying, but there's sometimes you need to get some extra help, and I encourage people to also do that. It doesn't help, it doesn't hurt. And that, to Sabrina's point, and especially in our community, African American community, people have like a negative kind of stigma about getting professional help. But I learned during college after I lost my mother to MS. I was talking to one of my advisors. She said, "You ever thought about going to see a counselor?" And I was like, "A counselor? That was the best thing I could have ever done." All the while I was still going to church and praying, but it helped me. So I do know the benefits and also seeking counseling. And I have prepared myself going through this journey. If I need to, found some good counselors in the event that I need to follow up with someone. And who's to say I might not need to follow up with someone in the future, but I will when needed.
As far as stigma type barriers, growing up, I'm a large male. We're supposed to be strong. We're supposed to be tough. We're not supposed to be not that. And, so I found myself growing up just being strong, pushing through those things. And once all this mental health with diagnosis, pre-diagnosis, post-diagnosis, once all this struggle started coming on, it's just, there's no more time for games. That there's no more time for this to be a stigma. It's that important. It just can't be a stigma.
Excellent. I love that. Thank you, Andy. Kim?
Thanks, Catherine. The barrier that I've had to overcome is my own self. I am naturally a caregiver. I take care of people, not only as like my job, it's a huge part of my personality. And to be the one who needed to ask for help, whether it was ask my wife to help me with something physically, or that I needed to talk to her about something, asking my counselor if I could come more than once a month. Those are not things that I do easily. And so that it was just my own kind of fear of stigma, but also just, well, I'm the one that takes care of everyone. Like, I don't need anybody to take care of me kind of attitude was something I really had to work on and kind of change. Like, it's okay to ask for help, and people will help you if you ask.
Oh, great reflection. Thank you so very much. And you all, even with those barriers that you faced, you still found a way to prioritize your mental health. And, kudos to you, and pat yourself on the back, because it's not easy to take that first step and to, like we said in the beginning, to be aware and to acknowledge, those feelings internally. So what advice would you give someone who is hesitant to acknowledge their mental health struggles? So somebody that, whether they're newly diagnosed or, have been diagnosed for years, they're in the IgG4-RD community and they're struggling with their mental health. What would you say to encourage them to take the first step?
It's okay. I would say it's okay to reach out and ask for help. There's nothing wrong with that. Do not suffer in silence. Lean on those individuals that have offered to help you, and that's okay. Everybody needs help, and do not beat yourself up. Especially like as Andy said, men, we have this like we have to be strong, like we shouldn't cry, we should be tough all the time. No, we're dealing with something it's rare, and all of us have been. So no telling what your journey has been, but please reach out. Whoever this may be out here watching this, reach out to me. I'm happy to, find someone that you can talk to that can get you to where you need to be so you can get the help that you need.
Beautiful. Thank you, Damon. Sabrina?
Catherine, there's an aspect of care that's called the biopsychosocial model.
Mhm.
And I love that model because it examines kind of the interconnectedness of the biological, psychological and social factors that affect a patient's, development and their outcome. The thing that's important to me about that is that addressing all three is necessary. And I don't think we realize that we can't just give attention to one area and not attention to the others, by if you give all of your attention to the physical aspects of what's going on with this disease, you are likely exacerbating or making worse the mental aspect. And so I just want people to be aware that you've got to take care of the whole you and not just parts of you regarding this disease.
Yes, thank you so much. Andy?
If I was to say one thing to someone struggling, I'd say tell somebody, anybody, just make it a topic, just say it, even if it starts out with just saying it to a mirror, talking to yourself, maybe it starts there, but tell somebody, the deeper you put it down, the bigger it becomes,
I'm just gonna piggyback right off of Andy. I mean, the biggest thing a piece of advice I can give is to make that first difficult step of talking about it, whether it's you need to write about it in a journal and read it to yourself. You need to stand in front of the mirror, like Andy suggested, and talk about it before you feel comfortable to talk to someone. Just starting the conversation is the biggest thing, the most important part.
Thank you all so much. These are such great, insightful, beautiful responses, and I appreciate it also very much. So as we begin to bring this very, very important conversation to a close, I want to take a moment to reflect on the valuable insights and experiences we've shared today. Mental health is such a vital part of the journey with IgG4-RD, and hearing each of your perspectives has not only highlighted the challenges that you all have faced, but also the resilience and strength within this community. The resilience and strength within this small group right here is amazing. All of you have been through so much, and the insights that you've been able to share today are just remarkable. So thank you so much for your openness, your honesty, and your experiences and insights are incredibly helpful. So before we sign off, I know that I just asked you about what you would say to somebody in terms of seeking out care for their mental health. But what I want you to think about right now is what's one thing you hope others will gain from hearing your story. So let's go around the group one last time. Andy, what's one thing that you hope somebody watching this today will come away from this with?
I hope that if, someone's out there in the same shoes and they're starting to spiral and they're not seeing anywhere for it to go, that, maybe a thought would pop into their head. Maybe I can reach out. Maybe I know so-and-so likes to talk. Maybe I'll reach out to them. Maybe an old friend I haven't talked to in a long time that's non-judgmental. Maybe I'll reach out to them, so maybe taking the first step is a real admirable thing to do. I've always really tried to take it easy on myself, and I would say, listen, everybody out there is going through something, and don't forget to tread lightly with yourself.
I gotta put that tread lightly with yourself in my self-talk, put it on my self-talk board. That's good. So what I hope everyone has heard today is that, there's absolute value in self-care. And I want to underscore the importance of acknowledging caring for your mental health and well-being. We all travel very different social roads, but the common path we have is our IgG4-RD journey. The path, is arduous. It can be, for some of us, it has been. And I simply want you to know that you don't have to walk alone. You can walk with family, you can walk with friends, you can walk with us now, thanks to the foundation. You don't have to walk alone.
Don't say you got this. If I can do it, you can do it too. And to piggyback on Sabrina, you are not alone. Um, if you don't have anybody that you don't think you can call on, like Sabrina said, you have us now. Keep your hope. Jesse Jackson said, keep hope alive. Like, honestly, please do not give up. Keep hope. Find something to hold on to. You can defeat this. You will defeat this. And do not suffer in silence. Say something. Find somebody to talk to. But you can do this. We can do this. We got this.
Well, I feel like everyone summarized my points pretty well. The only thing I think I can add is that the journey to diagnosis is an emotional roller coaster. It's an emotional roller coaster after you're diagnosed. Some people experience this roller coaster over the course of a few months. Some people experience it over the course of years. I mean, everybody is different, but the important thing to remember is no matter how crazy you think you might be feeling, somebody else has either felt that exact same way or is currently feeling that way. So kind of just to tie things up, the big thing that I feel like we're all kind of saying is you're not alone in this.
Wow, I literally have goosebumps from everybody's responses because they were truly so heartfelt, and I hope that people watching will feel exactly what I'm feeling right now. And thank you all so much for, like I said before, being vulnerable, taking the time to come and speak about your mental health. It's not easy. It's not easy in this society. And I appreciate all of you for knowing how important it is. And it's clear that while the journey with IgG4 related disease can be challenging, there's so much strength and hope in our community. And like you all just said, please remember you are not alone on this path. There is support available, and by staying connected, we can continue to learn and grow and support one another. So thank you all, Kim, Sabrina, Andy, Damon, such great, insightful conversations here, and I'm looking forward to sharing this with everybody. Thank you.